The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Welcome. We are here today for the next episode of TMD Demystified. I am Tony Urbanic. If you've been following our episodes along, you may recall that the last couple episodes I had promised to cover the topic of what periodontal disease and TMD have in common. I have been meaning to get across this topic for quite some time, and because of other interferences, other topics, it had to be delayed. But today, I'm going to talk, hopefully briefly, about what TMD and periodontal disease have in common, and it's quite something. It is extremely important, maybe paradigm shifting even, depending on your point of view. Let's just make a couple comments about each of those diseases that are factual. First of all, it is well established that inflammation is the primary cause of all the symptoms of temporomandibular joint disease, TMD. That has been covered in great detail throughout these episodes. But inflammation itself can directly be responsible for causing headache, earache, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, upper back and shoulder pain, arm, hand, finger tingling, and numbness, and various kinds of locking. That is established in many different ways, but specifically in my case, after doing 2,000 temporomandibular joint surgical cases, and each and every one of those cases taking a piece of tissue from the surgical site, whether it be through an open joint incision in front of the ear, giving access to the joint, or through an arthroscope. Each of those 2,000 plus cases, a piece of tissue was sent to the pathologist, and when the pathology report returned in each and every case without exception, the first line of the report always described either chronic inflammation or the specific cells associated with chronic inflammation. So it's established that chronic inflammation is a part of each and every case of TMD. All right, secondly, we know that chronic inflammation is an established part of each and every case of periodontal disease. Much has been written on that. Very good science. Multiple scientific papers have covered that in detail. So we can easily say that chronic inflammation is commonly seen in both periodontal disease and temporomandibular joint disease. So they have that in common. There's another factor that they have in common, maybe not as strong as chronic inflammation. I think chronic inflammation is seen in each and every case of perio and TMD. But bruxism, or clenching and grinding, is a common factor in both TMD and periodontal disease. But it is a fact also that not all patients with TMD are bruxers, and not all patients with periodontal disease are bruxers. So it is commonly seen in both periodontal disease, that is, bruxism is commonly seen in both periodontal disease and temporomandibular joint disease, but it is not at 100%. not to the degree that chronic inflammation is seen in both. All right, with those facts established, I want to discuss very briefly the fact that there is a lot of information over the past 20, 25 years that has been studied, scientifically recorded in very good papers, primarily from the periodontal establishment, for the relationship between periodontal disease and other systemic diseases. Good papers, good science, especially focusing on cardiovascular diseases, but there are others which we will cover in a little bit. So it's well known, well established, and promoted heavily among dentistry and the dental establishment and hygiene establishment, the general dental establishment, that for very good reasons, it's important to treat periodontal disease for your systemic health. Granted, given, agreed upon. Now, my question is this, and I have not seen anybody ask the question yet. I have looked, I have investigated, and because of my focus on the temporomandibular joint problem, TMD, I wondered why no one has ever asked it before. But if periodontal disease and the treatment of periodontal disease is so critical and important to get it treated to decrease the inflammatory response within from other systemic problems, other systemic disease, why is it not equally important to treat TMD and the chronic inflammation that is known to be associated with TMD to 100% of the time for the patient's systemic health, obviating and limiting systemic diseases that are associated with chronic inflammation. And we'll talk about that relationship in a little bit, but there's good science showing that chronic inflammation from whatever cause or site can create problems and increased difficulty with systemic diseases. So why not the emphasis on TMD? It has not even been asked. It has not even been investigated. It has not been discussed. I don't know why, but I question that it needs to be. So the first question that I had when I began thinking of this, pondering upon it, was, well, how much inflammatory tissue can be created in periodontal disease versus temporomandibular joint disease? I'm very familiar with the quantity and quality of inflammation within the temporomandibular joint. And as an oral and maxillofacial surgeon, I'm very knowledgeable about the degree of inflammation within periodontal disease, primarily from the thousands of periodontally involved teeth that I have removed over my career. So it stands to reason that if you're concerned about inflammation within the periodontium, you should also be concerned about inflammation within the temporomandibular joint in relationship to systemic disease. How much is a question. So I'm going to take you through a little calculation that I did and the science that I used to calculate it. And I think you'll be surprised because I really did wonder. I sat down and I did a little investigation, pulled out some articles, which I'll share with you. They're available if you'd like copies of them. I'm not going to put them on a PowerPoint. I'm just going to describe the articles and I'll give you the reference. But to compare quantitatively how much inflammation can be created in the periodontium versus a temporomandibular joint. So first of all, we had to find out what is the surface area of the periodontium that can theoretically be involved with chronic inflammation. And according to this paper in the Journal of Periodontal Reserves, 2001, February issue 36, pages 48 to 55, the denogingival epithelial surface revisited. I'll give you right the bottom line of the abstract, that they recalculated this quantity. The surface area among individuals with periodontitis ranges from 8 centimeters square to 20 centimeters square, which would be in millimeters, that would be 80 millimeters square to 200 millimeters square. So that is the quantity of periodontal tissue that can be for 28 teeth that could be associated with chronic inflammation. The next would be, well, how could you compare that to the temporomandibular joint? Well, first you have to calculate what's the surface area of the temporomandibular joint. I used an article entitled Computed Tomography of the Normal Temporomandibular Joint in the Scandinavia Journal of Dental Reserves, 1987, December. The 6th volume, pages 499 to 509. And basically, in that article, it describes the diameter of the average temporomandibular joint is 16 millimeters, which would mean the radius of the joint, considering it is a concentric sphere, which it is not. We'll talk about that in a moment, but I'm just getting estimates here, would be 16 millimeters in diameter, 8 millimeters in a radius. All right, so the next article then would be what would be the surface area that could theoretically be involved with chronic inflammation within the temporomandibular joint. And to calculate that, I used the simple solution of area of a sphere, which is 4 times pi times radius square, which when calculated for 8 millimeters in radius would be 804 millimeters square. So we're comparing the volume of root surface of periodontal disease of 28 teeth, which could be as little as 80 millimeters and as much as 200 millimeters square, in comparison to the radius of the temporomandibular joint, which could be as much as 804 millimeters square. And then you have to discern, well, the temporomandibular joint is divided into 2 compartments, the superior joint space and the inferior joint space, separated by the meniscus and related tissues. So that actually would increase the volume of established tissues within the temporomandibular joint, maybe not a 2x, but to some degree. And then the fact that you have 2 joints rather than 1. And you can see that the amount of surface area, the quantity of surface area within the temporomandibular joint itself, bilaterally, exceeds significantly the quantity or surface area of the periodontium, which can theoretically be involved with each and every tooth of 28 teeth was involved in periodontal disease. How much chronic inflammation could be created? And so whether my numbers are exact, which I know they're not, they're estimates, they're rough and dirty estimates, but it is obvious that the volume is greater within the temporomandibular joint. The quantity is greater within the temporomandibular joint than in the periodontium. So why not as much emphasis on inflammation and its effect on the systemic diseases? And the answer is because no one thought of it before. I can't imagine that I'm the first, but I have not been able to find any articles. I have not been able to find any comments. I've not been able to find any abstract. I have not been able to find any discussion in comparing why chronic inflammation within the joint should be held in as least great amount of concern as it is with periodontal disease. So what are the systemic diseases that the chronic inflammation can complicate or bring about even? And so we'll just list them out here. But first of all, I will make a distinction between, chronic inflammation and periodontal disease, which is exacerbated by the bacterial biotome, amount of bacterial material that is within the periodontal problem. You will not find infection within the temporomandibular joint, just chronic inflammation. But keep in mind, you do not have to have bacteria to be associated with periodontal disease, or to be associated with temporomandibular joint disease, and that the cytokines, and a cytokine is nothing more than a secretion from one cellular type, to have a tremendous, significant effect on a different cellular type within the immune system. And therefore, bacteria does not necessarily have to be the insightful factor when you're comparing chronic inflammation within periodontal disease and temporomandibular joint disease. You have cytokines that are released in both that have significant effect on systemic organs and organ diseases. So all this is just a big question. I'm asking the question and bringing out the point. Why hasn't anybody up to this point brought out the importance of considering this relative large quantity of chronic inflammation that's been going on, and with some patients for 10, 20, 30, 40 years without resolution, creating effects on other body organs? So what are the other diseases that are of great concern associated with chronic inflammation coming from other parts of the body? Would be cardiovascular disease, pneumonia, rheumatoid arthritis, Alzheimer's disease, cancer, adverse pregnancy outcome, diabetes, liver disease, and gut dysbioses, problems with the gut. Now, a lot has been written on each one of those diseases and the relationship between chronic inflammation. It is not my purpose to write a paper on this topic via this episode on Dental Town, but I think that serious academic investigation needs to be addressed to this problem. And as one who promotes non-surgical treatment of the temporomandibular joint to do nothing more than decrease inflammation within the temporomandibular joint to resolve the symptoms associated with TMD, I would say that I am a major promoter of those investigations, whether they be done through our own organization or they be done through training organizations, through dental schools. I would encourage it. I would encourage it greatly. So let me just repeat this. There are significant papers on significant investigations, significant good information on how chronic inflammation has a significant systemic effect on these multiple disease processes, especially cardiovascular, and to be determined how much on these other diseases, rheumatoid arthritis, Alzheimer's, cancer, adverse pregnancy outcomes, etc. And those studies really are important to do. So I think for today, I have made the case. I hope that it is important to you to acknowledge it at least. And if anyone has any questions about the process I used, criticisms, comments, I'm happy to take them. But I'm really surprised when I laid it out logically that I couldn't find any other investigation, even comment about this process, since periodontal disease and the inflammatory process on systemic problems has been going on for 25 years. So with that, I'll leave it at that for you to ruminate on my comments. We'll just leave it as a short episode for today. If you'd like to help your patients and your practice treat TMD non-surgically, you can join our network of providers who use the Urbanic device and protocol to actually decrease inflammation within the temporomandibular joint. That's how it works, no more, no less. It decreases inflammation to the point where the symptoms of TMD that are created by inflammation diminish. You can find all about this on our website, www.urbanictmj.com. If you'd like to comment or talk to me, you can reach me at tonytmjservices.net. Our Director of Marketing and Education, Dr. Naomi Engelman Williams, can be reached at naomi@tmjservices.net. And we're happy to discuss any part of our knowledge and our practice and why it is important to treat TMJ non-surgically correctly. Until next time, I look forward to speaking with you again, and we'll have another hopefully interesting topic. I am Tony Urbanic, and this is TMD Demystified.